Hi guys, today we can see here an important topic that is in the pediatric nursing. Okay, the topic that should be used in theoretical as well as in practical aspects. Okay, the topic is neonatal resuscitation. Okay, it is very important for your theoretical point of views. That is neonatal resuscitation. Resuscitation. Okay, neonatal resuscitation, it is important topic. If it is, that should be coming up in our examination at almost about 5 marks. Okay, now uh, that neonate resuscitation, before going to this neonate resuscitation, here neonate resuscitation move about 10% of all the infants that is born with or the neonates, they needs resuscitation. About 10% of neonates or newborns, you can write here, newborns, they need resuscitation. They need a minor resuscitation. Okay, minor resuscitation. Now if it only less than 1% needs severe and immediate resuscitation. Okay, resuscitation. Here that this is our okay, how we can resuscitate and to whom can we can resuscitate. Okay, now there are some questions. The nurse, as a pediatric nurse, whom to resuscitate, which baby she or him or she yet need resuscitation. Okay, there are some questions are there, like here. First question is the what is the gestational age. Okay, what is the gestation age? Gestational age. Oh, it is one question. Second question is breathing or crying. Okay, breathing or crying. If the child just born after just delivery, after the delivery, he is or she may breathing or crying, if it is there or not, it is a question. Okay, next muzzle tone. Muzzle tone. These three questions are very important. uh, Here, first is what is the gestational age. If it is the child is born before 37 weeks and after 40 weeks, that may consider as preterm and postterm. Okay, now breathing and crying, if it is not there, it means there is no opening or expandation of lungs is not there. Next muscle tone, it means there is a no muscle tone, that is no muscle activities involved here. Okay, these are the some questions. Okay, if answer of this question is yes, if it is yes, we can give supportive care. Okay, supportive care we can say. Okay, supportive care. Okay, supportive care. In that supportive care, we can simultaneously see this Apgar scoring. Sorry, Apgar. It is Apgar scoring. Okay, Apgar scoring. If you want a detailed video about Apgar scoring, let me know in our comment section. Okay, I can make a video about Apgar scoring also. Okay, now this is the question here. If it is yes, we can give a support to care, Apgar scoring, and the immunization, water should be there, and vitamin K, all these things. Okay, that is a different state. Now here that is a gestation. If it is no, what happen? The answer, if it is no, then the child may need resuscitation. That should be in four category. That is a T A B C. That is T A B C. Okay, T A B C. Now, what is a T here? Okay, what is a T means? That is maintenance of temperature. Okay, maintenance of temperature. Temperature should be maintained at first. Next, A is for airway management. Airway management. Okay. Next, third is C is breathing. breathing. Next for C is circulation. Okay, circulation. Now this is our four things that should need to resuscitate a baby. Okay, that is TABC. Here we can see in detail about that is what how we can maintain a temperature, how we can maintain airway management, or how we can maintain airway potential. Next it is B is for breathing. Next C is for circulation. How we can make this? This is all about our introduction part. This is resuscitation. Now we can deal with each one in detail. Okay, now yes, now first thing is here, first thing is maintaining of temperature. Okay, that is temperature. In that we can do here, first is first we can do is here drying. Okay, drying of the baby. Okay, and second is removing of wet cloth or wet linen. Okay, next third is temperature maintaining. Put baby under warmer. Which warmer? Radiant warmer. Okay, radiant warmer. This should be done in maintaining the temperature. Okay, when at the time of delivery, when we receive a baby, that should be received in a pre-warm towel. That should be warm in the radiant warmer. Okay, in a sterile technique, there are two towels. One towel we can receive the baby and we can tap, and all the secretion, all the amniotic fluid should be removed, except vernix gaseosa. That should be a antibiotic for the neonate, as well as that prevents the hypothermia. Okay, next removing of the wet linens. If it is wet linens are there, that may cause hypothermia. Okay, next put baby in the radiant warmer. That is our maintaining the temperature we can maintain by this. Okay, next is our airway management. Okay, airway management. Here in airway management, what is the first thing we do here in airway management? Positioning is very important here. What is positioning? And second is what positioning we give in first. Positioning, that is we take a towel. Okay, we take a towel, by towel we roll the towel and place beneath or behind the back of the shoulders. Okay, that helps in the opening the airway. That helps in the opening the airway. Let me see, let me show here. This is the infant. Okay, this is his neck. It is, if it is straight, we can put here towel that should bring like this. Okay, it bend like this. By that, it is abdomen, these are the legs, and these are the hands. Okay, this open, this airway is open. Okay, this should be open by placing this towel here in the shoulder. Okay, okay, yes. Now it is positioning is completed. Next is sectioning. It is sectioning is very important. Sectioning of what? Sectioning of mouth and nose. Okay, mouth and nose should be section. Now third is there. If it is not reduced, if it is not maintained airway, by these two steps we can go for ET tube intubation. ET tube intubation. Okay, ET tube intubation. It is the thing here in airway management. Next, third thing is, what is the third thing? That is in what? Circulation. Okay, not circulation, that is breathing. First, breathing. What we do in the breathing here? First, see, it is in first we give here a tactile stimulation. What we give? A tactile stimulation. Okay, tactile stimulation. Now what is this tactile stimulation? Okay, tactile stimulation is that we are placing a baby on this non-dominant hand in the what, palm position, and we are rubbing the back of the infant and tapping the back. It is our tactile stimulation. Okay. And second is breathing is tactile stimulation is there, and second is there positive pressure ventilation. Okay, positive pressure ventilation, positive pressure ventilation, ventilation. Okay, this is our second thing. This is come in the breathing. Next, fourth, it is circulation. Fourth, it is circulation. What we do in the circulation, first is chest compression. Okay, first we give is chest compression. Chest compression. Chest compression. Second, we give here medication. Medication we can give here. Okay, and that medication should be, it's very important to remember here, the medication in neonates should be given via umbilical vein. Okay, umbilical vein. Okay, this should be umbilical vein. Here, what are the medications you give to the in neonates? Let me show here. This is a medication. Under in the medication, this is this points. Okay, let me write here. First medication A, we give here adrenaline. That should be about 0.1 to 0.3 ml per kg of body weight. Okay, that should be given. It is adrenaline. Next is B. We can give here, B is a soda bicarbonate. That is sodium bicarbonate. Soda bicarb, I can write here. Soda bicarb. That should be about 2 ml, or sorry, 2 ml. It is 2 ml per kg. It should be given, and it should be 1:1. It means if it is 1 ml of soda bicarbonate, we can take, they should be added with 1 ml of distilled water. Okay, that is 1:1 dilution is there. Next is medication. In that medication, one is completed. Next, it is dilution is there, bicarbonate. Third is volume expander we can give. If it is not resolved by the soda bicarbonate also, we can give. Third is volume expander. What are the volume expander here? Volume expander, volume expanders like this is our RL, NS. Okay, these are our volume expander. Okay, we can give this. This is our neonate resuscitation. Okay, first temperature, airway management, breathing, and circulation. In that this breathing and circulation, that should be done simultaneously. Okay, that should be done simultaneously. Okay, next we can see important topic, that is steps of neonatal resuscitation. Okay, what are the topic? Next is steps of neonatal resuscitation. Okay, steps of neonatal resuscitation. Okay, here, soon after the birth. Okay, soon after the birth, if it is a child is born or a neonate is born, here after that birth, there are some questions are there. Okay, what is the question? First question is meconium. Meconium, if it is clear or not, first question. Second is skin color. Skin color, if it is cyanosis or a pink. Third is muscle tone, if it is there or not. Fourth question is um, muscle tone is completed, skin color is meconium is there, and fourth question is respiration. Okay, respiration or cry we can say here. Term gestation. Here, if the answer of this question is yes or it is normal, then we can give a supportive care. Supportive care to a neonate. If it is no, then we give what? If it is no, then we give that provide position. First, provide position Positioning. It means we can provide a position that should be maintain airway potential. Okay, first is this. Second is position should be there airway clearance. Okay, airway clearance. Airway clearance, that is suctioning. Third is suctioning. Suctioning. Fourth is O2 administration if it is needed. Administration if it is needed. Yes, so yes, you can write here if it is needed. Okay, now after this we can evaluate. After this, evaluate. What we have to evaluate? First is heart rate, respiration rate, and skin color. After evaluation, if it is heart rate is more than 100, okay, more than 100, we can give supportive care. Okay, if it is pink, baby is pink in color. Okay, heart rate is normal, not how normal, that is more than 100. If it is less than 100, if it is heart rate is less than 100, then we should go for positive pressure ventilation. Positive pressure ventilation. Positive pressure ventilation. Okay, after that also, after some time we provide this positive pressure ventilation. If the heart rate is again goes to down, the heart rate is again goes to less than 60 degree, sorry, not 60 beats per minute, then we give PPV. What is PPV? That is positive pressure ventilation plus chest compression. Chest compression. Okay, chest compression we can give here. After, if again after chest compression and this positive pressure ventilation, again if it is heart rate is not maintained, if it is not maintained, we give administered drugs. If it is positive chest compression and all these things we give, if it is again the heart rate is less than 60 only, then we give medications. Okay, then we give medications. Okay, medications. In medications, what are the medications we give here? That is, after medications we intubate a child. We intubate. Intubation, ET intubation. ET intubation should be done. The medication is first preference is adrenaline. Adrenaline, it is about 0.1 to 0.3 ml per kg. Okay, next second is bicarb. Okay, it is about 2 ml per kg. Dilution is 1:1. Third, we can give plasma expander. That is our RLNS. Okay, this is our plasma expander. This is our steps we can follow in our neonatal resuscitation. Okay, these are the steps. If any doubt is there, if any query is there, let me know in our comment section. Please like, share and subscribe. Okay.